2020, emergency department visits in Virginia by patients who said they vape jumped significantly, and now an increasing amount of research shows the chemicals in e-cigarettes start to inflict damage right where they enter the body, your mouth. So joining us now to tell us more is Dr. Lindsay Thorne from Lat Dentistry. Welcome to the show. Great to have you.
Thank you so much. I'm happy to be here.
Yeah, and I'm glad that we're talking a little bit about this because I think that there's a lot of misconceptions when it comes to vaping that's better for you than smoking is.
Right. I mean, it was originally put on the market as an alternative to smoking, and so many people think that it's a healthy alternative, but what we know now after 20 years of research is that it causes pretty major health problems and oral health problems.
Yeah, and I was going to say the research is fairly new on this, but yeah, tell us a little bit about what you're seeing when it comes to our oral health if we vape.
Right, so there's a whole range of problems that can happen with vaping. The biggest thing is the chemicals that are involved in these vape products. They can cause things like dry mouth, cavities, inflammation, which is a really major problem for a lot of people, and that can lead to recession and tooth loss and bone loss, just about everything that you wouldn't want to happen. So
right, yeah, and I understand. I was listening. We were talking before the show about this podcast that talked a little bit about oral health is directly correlated with our overall health. So explain that a little bit? Like if I have periodontal disease or gum disease, how is that going to affect my overall health?
That is such a good question. And periodontal disease or gum disease, which is something that most adult Americans experience, has really major links to whole body health. So things like stroke, heart disease, even things like early onset dementia, which people don't really realize are linked, but the bacteria and inflammation that travels through the bloodstream affects every part of the body. And it's a massive thing to consider in terms of keeping the body healthy.
Yeah, and you kind of touched on this, but we were talking about the nicotine in cigarettes and in our vaping, but the chemicals too that are going directly into our mouth is causing major problems. So what are you seeing in the dentist's office right now?
So we know that not only are teens using it more, but also adults. I myself am seeing more and more people of all age ranges that are vaping. We're starting to see links to oral cancers in different ways that are pretty surprising. We're even seeing simple things like staining and darkening of teeth, which people don't want to experience either. Right. But it's definitely something that I think is really important that people understand. It's not good for you. It's not good for your teeth or your body.
Right, so. Yes, and it's highly addictive too.
Correct.
So yeah, don't even if it, and I hate the fact that, I see some of these containers and they're like special flavors and they're really marketed to younger and younger people and getting them hooked earlier and earlier.
Right.
So it gets it harder to quit something like this. So let's talk a little bit about the message that you want to get out there for people who are vaping right now.
The biggest thing that I would say is talk to someone, whether it's your healthcare provider, your dentist. We're all here to help you stop vaping. There are so many great alternatives that people can go to, but the biggest thing is just getting help and understanding that there are other things that you can do that are better for your body and for your teeth.
What are some of the signs that I might have a problem? I mean, is bleeding of the gums? What are like some signs that I can look into my own mouth and say, oh, that's not right? Right.
So if you're seeing a lot of dark spots, bleeding of the gums is a big sign. So if your gums can bleed easily when you're brushing and flossing, that's a problem. Your gums should really function like your skin, and so they're a barrier for bacteria to get into your bloodstream. And so if anywhere on your body, if you could easily make your skin bleed with a toothbrush, you'd probably think that's a problem.
Yeah.
But if you can make your gums bleed with a toothbrush in the mouth, take that as a sign. And so that's a time to go ahead and get checked out and see if there's anything that you can do.
Yeah. And is there something that you can do? Quit, right?
You can quit. You can work on your home healthcare routines. Sometimes for the people that don't want to quit, I'll even suggest rinse out with water after, at least to try to get the chemicals out of the mouth and the oral tissues. Brushing after even is something to consider as well.
Okay. And of course, make an appointment, right? If somebody has questions and maybe they're concerned, they can reach out, right?
Absolutely. Call, make an appointment. We're happy to talk to you in any way and see if we can get everything taken care of.
Okay. We're going to put that information up on your screen. There it is. And of course, we'll have it over on our website as well. Thank you so much for stopping by.
Thank you. Thanks for having me.
Absolutely.